Okay friends, let us discuss about one more frequently asked 5 mark question, that is the vitamin. It is the vitamin D and its mechanism of action, adverse effect and its therapeutic uses. Let us know what is this vitamin D. Vitamin D is known as the fat soluble vitamin. Basically there are 4 fat soluble vitamins, that is A, D, E, K. These are all fat soluble vitamins. Vitamin D is one among them. It is also known as prohormone, which is converted into a number of biologically active metabolites that functions as a true hormones. That means this vitamin D can be converted into many different hormones inside the body. So vitamin D plays a major role in the maintenance of some metabolism. Especially it plays a central role. It plays a maximum role in the maintenance of plasma calcium and also bone formation. So vitamin D is especially found in the fish liver oils and dairy products. So that is why it is said daily दूध पीना है, every day drink milk. And also vitamin D we get vitamin D through exposure to sunlight. That's why we need to play in the sunlight, not in the noon. Anyway, playing in the sunlight is also good. Then let us see what is this pathways of vitamin D production. Wow, they have given very beautifully. Let us see how does it works. Okay, see, vitamin D is basically 7-dehydrocholesterol. In the skin, when the UV light passes and penetrates to the skin and reaches this 7-dehydrocholesterol, it turns into, we have 7-dehydrocholesterol in the skin. Due to UV light present in the sunlight, it turns cholecalciferol. Cholecalciferol is the vitamin D3 which is inactive. In the liver, this cholecalciferol converts it into 25-hydrocholecalciferol. Similarly, in the diet, we will get ergocalciferol. Ergocalciferol, it is the dietary vitamin which is D2. And cholecalciferol, it is vitamin D3 which we get through sunlight. Both in the liver gets converted into 25-hydrodeoxycalciferol. So in the kidney, this get converted into 1-alpha-25-dehydroxy ergocalciferol and 1-alpha-25-dihydrocholecalciferol. And in the liver, there is another thing called alpha calcidol, which is also called 1-alpha-hydroxycholecalciferol. We have 25-hydroxycholecalciferol and 1-alpha-hydroxycholecalciferol. Both get converted into 1-alpha-25-dihydroxycholecalciferol, which is so-called calcitriol. Means dehydrocholesterol which is present in the skin gets undergo different metabolism and finally gets converted into calcitriol. Similarly, this ergocalciferol which is present in the dietary vitamin, means dietary vitamin D2, it's get converted into active vitamin D2. Let us see what function it plays majorly. Yeah, see, here is the action. Okay, let us see the actions of vitamin D3. In the GIT, vitamin D, it acts, means that calcitriol which is found in the liver, it acts on both GIT and kidney. In the GIT, it promotes the absorption of calcium and phosphate from the gut. In the kidney, it promotes reabsorption of calcium and phosphates in the renal tubule. And also vitamin D also play a role in the bone. GIT it causes absorption, bone it causes reabsorption, and kidney it causes reabsorption. In all the three cases, it acts on calcium and phosphate metabolism. This reabsorption or absorption include the level of the calcium and phosphate both in the plasma. This calcium phosphate, which is more in the plasma, is used for the mineralization of the bone. As the mineralization of the bone is done, the more bone get more denser and more stronger. So this is very essential for the formation of bone. So we know that vitamin D deficiency causes rickets in children. Basically, vitamin D deficiency causes rickets in children and osteomalacia in adults. And also we can say that increase in the vitamin D might also causes hypercalcemia, because more of calcium deposition, and nausea, weakness, fatigue and polyuria. If hypercalcemia persists, the calcium salts are deposited in the kidney, resulting in renal failure and renal stones. More vitamin D3 also dangerous because they causes renal stones. Then treatment includes immediate stoppage of vitamin D and low calcium diet and intravenous hydration and administration of glucocorticoids. This vitamin D3 and glucocorticoids, they act antagonistically, means opposite to each other. Let us see in what ways the vitamin D can be given to a person. We know ergocalciferol, which is taken through nutrition or dietary vitamin D2. We can give oral capsules 1/400 international unit to prevent rickets in children. Vitamin D3 either given orally or intramuscular injection. Calcitriol. See, this calcitriol is active form of vitamin. Oral capsule and solution can be given. Then prodrugs such as alpha calcidol and dihydrotachisterol. These are prodrugs, orally effective, do not require activation in the kidney, are rapidly biotransformed into calcitriol in liver, and they are effective in renal bone disease and hypoparathyroidism. Means this vitamin D3 is basically given due to the treatment of hypoparathyroidism. Means when there is a decreased level in the calcium in the body, all these conditions like rickets and osteomalacia, all these things have low level of calcium in the plasma, so this is used. Therapeutic uses: prevention and treatment of nutritional rickets and osteomalacia. Renal rickets, it is also associated with chronic renal failure. Hence, the conversion of calcitriol does not occur. It is treated with calcitriol. When there is a renal failure, there will be no conversion of calcitriol. Hence, the man-made or artificial calcitriol or vitamin D3, active vitamin D3 can be given for the patients who has chronic renal failure. And also vitamin D dependent reactions. It is an inborn error of vitamin D metabolism. This is failure of calcifediol to calcitriol, that is there will be the failure of vitamin D3, means inactive form to active form. So it responds to calcitriol. Vitamin D resistant rickets and osteomalacia, X-linked disorder. Okay, there are some diseases like vitamin D resistant rickets and osteomalacia. They are basically X-linked disorders of calcium and phosphate metabolism. They are treated with large doses of vitamin D and phosphate. In hypoparathyroidism, the hypocalcemia and hyperphosphatemia, calcitriol and are effective for temporary treatment of hypocalcemia. Administration of vitamin D with calcium is senile, and postmenopausal osteomalacia improve the calcium balance. Means this vitamin D along with the calcium can be given to the most postmenopausal women to reduce the risk of fractures, to treat the osteoporosis, Vitamin D analog, that is calcipotriol, is used topically for the treatment of psoriasis. This is important. Vitamin D analog is used to treat psoriasis. That's all, friends. Thank you.